I think when you look at the lay of the land today in the context of how professionals in our shared space have been viewed, they've really been catering to a relatively small percentage of the overall population. There's about 15% of the population is active in participants in structured physical activity programs that are professionally led. And as we move forward in the context of health reform and the enhanced focus on prevention, there's a tremendous opportunity, the connection between the clinic and the community, where the exercise professional that's highly qualified with that accredited credential has the ability to serve as the connection between the clinic and the community. So translating the information that the physician or the nurse is providing around we need you to move more, be more physically active, and make better choices around your lifestyle behaviors. For those individuals now that are looking for the leadership and expertise, we believe that there's a significant opportunity for professionals that are part of the CREP family, if you will, to serve in that capacity.
I understand that there's an advocacy role for CREP to play.
Sure. And that really was one of the primary purposes for forming the coalition, was to give the broad range of exercise professionals a shared voice with policymakers, with the government and other stakeholders. Together, the coalition represents well over 150,000 individuals that are practicing, which gives us some critical mass on those. And what we want is to have a voice for our shared professionals and a place at the table when the discussions are being held around, who is qualified, who should be providing services that are around that physical activity, exercise, leadership, and expertise.
Okay, so CREP is not proactive in trying to stimulate legislation. Rather, it's about being proactive when legislation is proposed. Is that correct?
That's correct. I think everybody is concerned about licensure and regulation in the space. Currently, there aren't any states that have it in place, although Washington, D.C. as a municipality is putting a registration process in place. While we're not proactively going out and seeking regulation for the space, we are responding to policymakers that feel that it's important, either from a consumer protection standpoint or for positioning the profession for growth and success. And what we want to make sure is that anything that they put in place is reflective of the best practices that they employ for the regulation of other adjacent health professions like athletic training, occupational therapy, dietetics, some of the areas of specialty nursing, where it's based on that NCCA accredited certification and then eligible to work criteria, which could include a background check in our space. But there's more to it really than just the licensure element. There are other professions that are interested in expanding their scope of practice to include physical activity program design and delivery, and we want to make sure that professionals in the exercise professions have the ability to continue to practice their craft with an appropriate measure of autonomy alongside and in cooperation with those other professions, so that we're really not standing over each other's respective scope of practices. Further, there's an opportunity at the federal level around recognition for the exercise professional as provider, and not a provider in the way that you'd look at a primary care practitioner, but a provider of services around physical activity and lifestyle behaviors. And then there's also the positioning of the profession. There's a number of tax-related issues that we've been exposed to in 2014 that really unfairly position the exercise professional. In one case in Nevada, it was as live entertainment. And certainly we don't believe that any of our professionals, while it's important that they provide a participant and a client experience, they're certainly not entertainers. They're professionals like other health professionals that are there to provide a professional service. And it's important to note that there aren't any other health occupations that services are taxed.